Sleep hacks every cancer patient needs to know. Sleep is often undervalued during cancer treatment, yet it's one of the most critical components of healing. Welcome to Tea Talk, everyone. If you don't know me already, I'm Dannie Cade. Every system in the body, immune function, hormone regulation, tissue repair, and even emotional resilience relies on restorative sleep. When sleep is disrupted, fatigue deepens, side effects intensify, and the body struggles to recover. For patients, prioritizing sleep isn't a luxury, it's an essential therapeutic strategy. Cancer treatments, including chemotherapy, radiation, and surgery, place an enormous amount of stress on the body. In response, the body needs more restorative sleep than usual to repair tissues, detoxify cells, and strengthen the immune system. Unfortunately, treatment-related side effects such as pain, nausea, medication schedules, anxiety, or hot flashes can severely disrupt sleep patterns. Understanding how to protect and enhance sleep is therefore really crucial. During deep sleep, the body releases HGH, known as human growth hormone, and is produced by the pituitary gland, big words again, and plays a major role in tissue repair, muscle recovery, and immune function. The immune system also strengthens up during sleep by producing critical cells that help fight infection and support recovery. Sorry, can't do a thing with this thing today. Additionally, sleep regulates cortisol, the stress hormone. High or dysregulated cortisol levels, which is common in cancer patients, interfere with healing and can increase inflammation. Restorative sleep resets these systems, improving both physical and mental resilience. Your environment profoundly affects your sleep quality. So keep your bedroom dark, cool, and quiet. Things like blackout curtains or eye masks, even white noise machines can reduce disruptions. And limit your screen time before bed, as blue light from phones or computers suppresses melatonin, the hormone that regulates sleep. If you can, kill the Wi-Fi, unplug all non-essential electronics, and keep your phone out of reach or in airplane mode to reduce EMF exposure without cutting off your emergency access. Investing in a comfortable mattress and supportive pillow also enhances physical comfort, which is essential for patients experiencing pain or stiffness. Consistency signals your body that it's time to rest. A calming bedtime routine might include things like gentle stretching, reading, deep breathing, or listening to soft music. Aim to go to bed and wake up at the same time every day, even if naps are necessary during the day. Short daytime naps can be restorative, but they shouldn't be replacing your nighttime sleep. Side effects such as nausea, pain, or hot flashes can easily interrupt sleep. For pain, try using positioning aids like pillows or wedges, or consult your medical team for safe pain management options. For hot flashes, dress in breathable fabrics, keep water nearby, and use a fan if you need it. For nausea, small sips of water, you can maybe even toss in a quarter teaspoon of baking soda can help. Ginger or peppermint tea, or try a light, bland snack before bed to reduce discomfort. Anxiety and racing thoughts are common in cancer patients and can make sleep feel impossible. Poor sleep worsens anxiety, and anxiety worsens sleep. This loop can be eroded emotional resilience, increased fatigue, and reduced treatment tolerance. That's why addressing nighttime anxiety is a therapeutic priority, not a luxury. Mindfulness, guided meditation, and deep breathing exercises are highly effective for calming the nervous system. Even just 5 minutes of focused relaxation before bed can improve sleep quality. Journaling about worries or concerns like scanxiety can also help externalize stress and reduce nighttime rumination. Fatigue is very common during treatment, and short, controlled naps can restore energy. In fact, aim for 20-30 minutes, ideally early to midday, somewhere in that range, to prevent interference with your nighttime sleep. Longer or late naps end up disrupting circadian rhythms, so timing is important. Sleep isn't an isolated necessity. It interacts with other aspects of recovery. Adequate hydration supports sleep quality, as dehydration or magnesium deficiency can cause leg cramps or headaches that interrupts rest. Proper nutrition, particularly balanced intake of protein, healthy fats, and complex carbohydrates, provides the fuel your body needs for restorative sleep cycles. Gentle movement earlier in the day can also enhance sleep onset and depth. Monitoring your progress can really help. So pay attention to your patterns. Are you waking up frequently? Are you feeling unrested? Experiencing maybe some vivid dreams or anxiety at night? Tracking your sleep can reveal what issues are interfering so that you can make gentle adjustments in your routine, environment, or support strategies. And sharing these observations with your care team can also help identify underlying causes and solutions. Sleep is tied very strongly to emotional well-being. A shortage of rest amplifies fear, frustration, and depression, making it harder to cope with treatment. So prioritizing sleep enhances mood, clarity, and resilience, all of which are essential for participating actively in our recovery. Finally, mindset matters. Sleep is not wasted time, but an investment in your body's ability to heal. So treat it like a therapeutic tool. Even on days when your energy is low or the side effects are challenging, protecting sleep supports every other aspect of recovery, from immunity and nutrition to movement and emotional health. In the next episode, we're going to get into mindset and resilience during cancer recovery, while lifestyle, nutrition, supplements, hydration, movement, and sleep all support the body. Cultivating mental resilience is the glue that allows patients to stay engaged, make good, informed choices, and maintain hope throughout treatment. Remember, sleep is foundational. Every night of restorative rest is a building block in your recovery, a quiet but powerful act of care that restores strength, supports immunity, and nourishes emotional balance. By treating sleep as a priority, you're empowering yourself to face treatment with greater energy, clarity, and resilience. And if you're around tomorrow, join me. I've got my weekly wellness show. It's going to be about wellness upgrades, from the unexpected benefits of lecithin to why collagen is more than just a skincare trend. Plus, we're going to be getting into this month's newsletter and the small shifts that help you feel your best. So join me tomorrow. I'll be right here, same time, an hour sooner, same station, and I hope to see you here then. Thanks, everyone. Take care. Great to see you all, and I'll catch you next time. Bye for now.